For a lot of people, cannabis is a regular part of life. Some use it recreationally to socialize or unwind. Others use it for medical reasons or as part of cultural or spiritual practices. Hi, my name is Dr. Kim Corace, psychologist at the Ottawa Hospital. More and more people are starting to reflect on how cannabis affects their health and whether it's still serving them. Cannabis can offer some people benefits, but it also can come with risks, and understanding these risks can help you make informed choices about your health. To reduce risks and support your well-being, it helps to take a step back and reflect on when and why you use cannabis. For many people, cannabis can serve different roles. It may be a way to relax or cope with stress. It may help with sleep or discomfort. It can be part of social connection or routine. Or it may feel like an escape during some of our difficult moments. Everyone's relationship with cannabis is different. Taking the time to understand what role it plays in your life is an important first step. Because when you understand your relationship with cannabis, it becomes easier to decide whether any changes may support your overall health and wellness. Cannabis can feel helpful in the moment, but over time, your body can build tolerance, meaning you may need more to get the same effect. And for some people, once those effects wear off, mood or stress levels can dip lower than they were before. This cycle can make managing stress, anxiety, or low mood more challenging over time. Understanding how cannabis affects you, both short and long term, can help you make more intentional and informed choices. The long-term effects of cannabis use are still being studied, but research has identified some important areas we need to be aware of. Regular cannabis use has been linked to an increased risk of psychosis and schizophrenia, especially for people who start using cannabis at a young age. Use it frequently. Use high-potency products or have a personal or family history of these conditions. Cannabis use can also worsen existing mental health symptoms, such as anxiety or low mood, and actually make them harder to manage. Smoking cannabis can harm your lung health, increasing the risk of chronic cough, bronchitis, and lung infections. And frequent or near daily use, particularly of those high THC products, increases the risk of developing cannabis use disorder. A helpful way to think about cannabis use is that risk exists on a continuum. The more often and more intensely you consume it, the greater the potential negative impact on your health. Now comes the reflective part. Many people choose to reduce or pause cannabis use because they want things like more stable mood and energy, better focus and motivation, improved sleep quality, less reliance on substances to cope, or a greater sense of control over their health. Even small changes make that difference, and those benefits can start to show up sooner than you may expect. Take a moment to picture what feeling better may look like for you. The goal here isn't to push yourself harder, it's to be more intentional. If you choose to use cannabis, Canada's lower risk cannabis use guidelines offer practical ways to support your wellness and reduce harm. Consider these options. Choose products with lower THC and higher CBD. Limit how often you consume. Occasional use carries less risk than frequent use. Try to avoid deep inhalation or breath holding if you're smoking. Avoid mixing cannabis with alcohol. And don't drive or operate machinery for at least 6 hours after use. Some people also choose to take breaks, reduce frequency, or stop altogether, especially if it feels that cannabis is no longer helpful to you. There's no one-size-fits-all approach. What matters is making choices that support your health and your goals. It's worth checking in with yourself from time to time. Are you using cannabis to cope with stress, loneliness, or difficult emotions? Are you consuming more than you intended? Does it feel harder to cut back than you expected? If so, that could be a sign to reach out for help. Support is available, and having conversation with that trusted person or health professional can help you explore your options in a safe, non-judgmental way. We've also linked helpful resources in the description if you'd like to learn more or know where to get some support. Rethinking your relationship with cannabis isn't about perfection. It's about awareness, intention, and choice. Every step towards mindful consumption of cannabis, which could include reducing or stopping, supports long-term health and wellness. and having the information you need to make those choices is a powerful place to start. I hope this was helpful. Thanks for watching.